Good morning. So today is a session in which you don't have to make any notes. Just watch, right? It's like just a showcase of all the bones, right? You'll be watching all the bones, their names, some important joints, and a very conceptual session, right? Because it is pretty long, as we'll be discussing almost all the bones. We'll be talking about most of the bones, right? Except some minor bones. So that's why straight away, without waiting, let's start, right? Regarding the emails and everything, right? We'll discuss later or tomorrow, right? Or I'll reply to that. Let's start. So let's watch all bones. And here is, right? He's giving us a nice smile that's what is in today's discussion. Okay, so here is the first one. This portion, this is what is called as the cranium, right? It is the cranium which will be having, which will be storing, which will be protecting our brain. So that is cranium. And over here, these will be all facial bones, right? We'll be going into that detail, but right now we just first we understand it in a very gross way, then finally we'll go into more detail. And this one is mandible, correct? So that's what you'll be learning in head and neck. Now these vertebra, right, they are the cervical vertebra. And obviously this one, the beauty bone, right, and also called as the collarbone or the clavicle. That's right. Now, today we'll also watch that how clavicle is closely associated with. Yes, definitely you can attend even if you have missed yesterday's lecture. No worries, because today it is like a very independent lecture. You'll by the end of today's session you'll be knowing every bone of the body, right, with a clear concept. So that's the clavicle. Now see, the clavicle is associated with one another bone, which is also a flat bone, correct? That flat bone is scapula, right? Scapula. We'll be going into more detail of this. And so over here, this is clavicle, right? Clavicle. And this one is scapula. And this one is humerus, correct? That is the humerus. Now see, we see a joint over here, right? We see a joint over here, right? So that would be very interesting. So again, right, this gentleman, right, this one is clavicle, that one would be scapula, and this one would be humerus, right, writing in short. And over here, we watch several ribs, so which is forming the thoracic cage, right? And this one is sternum, right? Now this sternum is divided into three parts. The top portion, which is like a shield, right? Which is like the shield. So it is called as the manubrium. Manubrium, right? Middle one is like body of the sternum, right? So we'll say it like the body of the sternum. And then there is a small process, right? Can you appreciate? This is like a small process, this one, right? That is what is called as the xiphoid process. Xiphoid process, right? Let's go more. This is what I wanted to show you, right? Now see, we'll be watching everything from various angles, correct? Everything from various angles. And now this is where we watch it from the top. So just consider it that we are watching it from the top, from here, like from here, from the head end. Change the color. This one, right? I'm talking about this one. So that one is the first rib, right? First rib. This one is obviously the clavicle, correct? That one is clavicle. And this one is scapula. I'm writing in very grossly the scapula. We'll see the parts, of it, right? So don't worry about the process and everything. Just listen. We'll talk about the processes and various parts as we discuss. So wait, this portion, right? This is thoracic inlet. Thoracic inlet. So the point is, when we'll be dealing with the thorax, right? When we'll be dealing with the thorax, so there is thoracic inlet. That is from where the structures of the neck, they will be going into the thorax, right? They will be going into the thorax, right? So this is the point. This is the point from where. Now, to make things still clear, here it is, right? Watch it, right? This is the portion. So everything isolated. Now, when you talk about that, say if this is the clavicle, correct? And we just said that clavicle would be articulating, right? Clavicle would be articulating. Clavicle will be making a joint with scapula. And I said that I'm writing very grossly that this is scapula. At this point of time, just watch for this. Just watch for this, right? There is a portion which is coming like this, and then it is communicating or talking with the clavicle. This process is called as the acromion process. Acromion process. Acromion process. So what should be the name of the joint? Acromion and clavicle. So we'll name this particular joint as acromio clavicular joint. Now, as such, it looks like a big name, but now you know that it is so simple, right? A joint which is between acromion process and the clavicle. That is called as the acromioclavicular joint. And this one is rib number 1, right? So when it is said that thoracic inlet, how it is formed on one side. So this side would be the medial side. Am I right? Because, right? This clavicle, this is the medial end, right? Over here, there would be sternum, manubrium sternum, right? So this is a medial side. So on medial aspect, whenever we'll be learning anatomy from the regional concept, we'll always be telling that, we'll be asked that boundaries, how the boundaries are formed, right? So in the boundaries, the rib number 1, it is on the medial aspect, clavicle is on the lateral aspect, and this, clavicle is in the front and scapula is on the lateral aspect. So that's how they are forming this triangle, and that is thoracic inlet, from where the structures will be going down, right? Okay, let's move further. Now this time we'll see something special. Okay, you want to change the color? Let's try out some different colors. Just let me know which color is better, so we can. How is this color? Is this better? Sure. Just for clarity of the colors, we'll just spend 10 seconds on that so that you find the good color, right? Okay, let me take this. Let's figure out how it looks like, right? Blue, let me try blue. This is better. Okay. So even this is, I just increase the density of the color, so that would be more clear. All right. So let's test these 2-3 colors. One, is this okay? Is this okay? Yellow. Okay, I'll put all of them. This is yellow, right? And the red. Let me make red slightly. I think this thing should be fine, right? That's the red. Okay, chalo. Coming back to this. Okay. coming back to, so this one is humerus. Okay, this one is humerus. That one is clavicle. So now I'll start writing in short. So, so that is clavicle. Now see the joint. This is the joint. So we named this joint as acromioclavicular, right? Clavicular joint. Excellent, right? Easy to understand. But now see, this is the whole clavicle. If I really make the outline, right, this is the whole clavicle. Right? This, right? Clavicle is a posterior structure on the back side, right? It is the posterior structure. So it is forming a joint with, not only the clavicle, but one very interesting joint, and that joint is this, that is with the humerus, right? That is with the humerus. So that one is called as the glenoid cavity. It is the glenoid. Yesterday we were talking about, right? It is the glenoid cavity. Glenoid cavity which is shallow, right? It is shallow. Glenoid cavity is shallow. Why it is shallow? Because we want mobility, right? We want mobility. Today I'll be showing you even the real bones. There would be bones which are generated with the graphics. There are bones which where there are real pictures would be there, right? So that you can appreciate that how they really look like. Now it's like if you are running and if you are having pain in the ankle, or let's say pain in the foot, so then you'll actually see that which bone is involved, right? You'll actually see that how the calcaneum is involved. You'll see that where exactly, why, how, when you go for a high speed run, how the talus is involved. So all those things we'll see in the form of real bones. Okay, so this is one, right? There are so many images that at the end of the show you'll feel like that yes, we saw everything. Nothing would be left by chance. Our basic principle, nothing would be left by chance. Okay, now we come across now one more new structure. Yeah, scapula, we are talking about scapula only, right? So here is, say, our scapula, which is posteriorly situated. Every bone will be shown from various angles so that concepts are completely clean. But do remember, right? Parallelly, keep on remembering that what were the words. I'll even repeat also. I'll keep on writing the same words again and again so that you are very clear. Beauty bone, right? Let's write beauty bone. So because now you know it so well, right? Beauty bone. It looks beautiful. And this one is acromion process, right? So that's why acromioclavicular. But then if this is acromion process, you must appreciate that there is another gentleman sitting over here. Here it is, right? This one, right? There is one more process, and this process is called as coracoid process. Coracoid process. Now, whosoever has given the names, right, they must be so creative, because coracoid is like beak of the crow, kauve ki chonch, right? Now I don't know which type of kauva it is, but anyway, this is the coracoid process, right? Process means extension. This is the bone, and then something is protruding, right? If it is very big, then it is called a spine, right? It is white kauva. Okay. Then this one, right? Now see how nicely seen. This is the glenoid cavity, right? Or the glenoid surface, glenoid cavity or the glenoidal surface. What I really want you to see technically is, watch the head of the humerus. Now don't worry, Yogesh, don't write any notes. As such, you'll be getting this file, right? And today there is not a single blank page. There are only images, right? That's the beauty of remembering or the learning anatomy. So don't write anything. Today just bindas watch it, right? Just watch it. So don't write notes. I would say if you see more, you'll be learning more. What I was telling was, if you can appreciate, I'm just zooming, right? I just zoom the thing, and what I really want you to see is, listen carefully. Humerus head. Humerus head is bigger, or or the glenoid cavity is bigger, right? That's the coracoid process, right? Janki, this is coracoid process, right? This one, right? So cora, right? I'm just writing cora. You understand rest. Coracoid process. Question is the glenoid cavity bigger or the head of the humerus? Exactly, the head of the humerus is bigger. Now see what happens, right? Your head of the humerus is bigger. This is cavity, right? If the head is bigger, so then head will be having so much of space for rotation, right? Because head can actually rotate, head can actually glide. No, cavity, watch carefully. Cavity is just thin, Varinder, right? Just watch it. That it is very shallow, right? Very shallow. Head is bigger, right? So head has got more space for really moving. True? True? I'll ask the same question when we'll be dealing with the lower limb. So you'll find that that acetabular cavity is so deep and bichara head of the humerus so bilkul andar stuffed, right? Because his function is stability, right? His function is stability. So that's fine, right? Let's move to further. Yeah, rest of the bones. Yes, you know, manubrium, sternum, and one question coming up. One question coming up. There is one process, right? This is one process. What's the name of this process? If you have listened carefully, this one was manubrium. This one was body of sternum. So then what is this which I have marked X? What is the name of this process? That's right. This is xiphoid, right? That's right. Yes, yes. That is xiphoid process. Good one. Good one. Good one. Good one. Nice. Now let's come to ribs, right? Very interesting. Ribs are extremely interesting because what they really do is, when you breathe, right? When you breathe, when the chest is moving, you have to do two things. One, you have to give more space, and at the same time you have to anteroposteriorly, it would in anteroposteriorly the chest should expand, and the vertically also it should expand, so that lungs, they can really expand, you can breathe, right? You can breathe thanks to the amazing association of vertebra which are in the back, right? Ribs which are making the entire thoracic cage, and the sternum which is in front. So that's how the whole thoracic cavity is formed. And what I was previously telling, right? I think someone asked about this thoracic inlet. See, this is rib 1. This is rib 1 on the top, right? Yeah, anteroposteriorly, because it should expand, right? So it is the elevation, right? The whole thing is elevated. We'll come to that. So this is the first rib, right? This is the first rib which is on the top, and this one is clavicle, and the scapula is over here. So that forms the anteroposterior, means anterior to posterior, right? So this is the chest. You are watching from the top. This is anterior, front. Posterior is back. So this is the anteroposterior distance, right? That's what is called as anteroposterior. So for example, when we write, say X-ray chest, right? Go for X-ray chest PA view. PA view, right? What does that mean? Postero-anterior. It means, say if this is the X-ray plate, I'll just put the X-ray plate over here. X-ray beam will be passing through me from the back side, and it will hit on this plate. So X-ray beam will be passing from posterior to anterior, and that's why it is called as X-ray chest PA view. Right? More when we'll be studying radiology, but this is just like some minor small things which we keep on learning parallelly. How is the thoracic attached to humerus joint? No, it is not humerus. With humerus, thoracic cavity is not attached, right? Thoracic cavity, it is just by this scapula. It is just the scapula, right? So when we move our hand, right, actually it is the scapula which is on the back side, but it's one of the surface, that is the glenoid, which is coming over here, and it is in attachment with the humerus, right? So that's why, because it is shallow, so yes, posterior means backside. So that's why this humerus, we can move our hands so freely, right? Because it is a shallow cavity in which the whole thing moves. So above, it is protected by acromion process, right? Now watch it. If you talk about this joint, above it is acromion process, correct? Acromion process. And then on this there will be several muscles attached. The biggest muscle, which is like a deltoid, right, which gives curve to your shoulder, right? Once you know these muscles, so you know which exercise to do, right? Which exercise to do. And when you do it systematically without exerting extra pressure on any of the other joints, you will be doing it more comfortably. Is the clavicle just touching rib 1 or having a joint? Well, there is no joint. There is no joint between rib 1 and clavicle. But yes, they both are so close because this clavicle is forming a joint with the manubrium over here with the sternum, right? It is called as the sternoclavicular joint. So sternum and clavicle, they will form the joint. The rib will be just passing underneath, right? Just passing underneath. Sternum is at a ventral surface. Ventral means anterior. You are perfectly right. And vertebra is at the dorsal surface. Dorsal means posterior. You are perfectly right. Right? Entire limb is attached to only clavicle or scapula? Only scapula. Only scapula. Right? Which I'm talking about the bones. Right? I'm talking about the bones. Otherwise, there will be rich muscles which will be coming all the way. They will be covering even the clavicle and then landing on the humerus, so that it forms a complete round solid joint. There will be even the tendons, right, which will make the entire joint so strong. So, but yes, you are right. It is only the scapula, right, with which humerus will be physically connected, right? Only the scapula. Okay. Moving on to the ribs part. Yeah. So here are the ribs. See the ribs. Why I said that ribs are very interesting. Ribs are in two parts. Even in us also, right? So it's not so only in fetus, but even in adults. The rib, which is connected on the posterior side with the vertebra, and as it comes forward, bus ribs are only this much. Ribs are only this much, right? It's not so that that bone is forming through and through the full joint, full circle. No, only this much. So rest is what? It is cartilage. So it is the rib and the cartilage's combination. How is it? Watch it here. Got it? See, I just highlight, say, this portion. This is cartilage. This is cartilage. This one is cartilage. This one is cartilage. This one is cartilage. This one is cartilage. That one is cartilage. And these are the cartilages, right? They are cartilage. Scapula is not attached with the vertebral column. No, right? We'll see the posterior surface. See, over here also you can see, right? Can you see it? Right? See, this is the medial border of the scapula. Medial border of the scapula. Scapula is posterior, but it is so far from the vertebral column, right? So far from the vertebral column. Regarding what is cartilage? Well, cartilage is a sort of connective tissue, right? It's a sort of connective tissue, but cartilage is relatively soft as compared to the bone. But cartilage gives flexibility. At the same time, their joints, they are pretty strong. So these are called as the costal cartilage. Very right. They are called as the, you eased my work. That is what is called as the costal cartilage. Now there is something which is special you must remember. And that is, how many ribs are there? 12, right? 12. So rib number 1, 2, watch it. 1, 2, 3, 4, 5, 6, and 7. The cartilage of rib 1 to 7, they are directly attached to the sternum. They are directly attached. True? So here is 1, 2, 3, 4, 5, 6, and here is 7. Rib 1 to 7, they are directly attached to the manubrium. Right? 8, 9, and 10, they land up like this. See, this one is number 8. See, it is going like this. It is attached to the rib number 7. Same way it happens to the 9. Same way it happens to the 10. Right? So 8, 9, and 10, they are indirectly attached. Quite easy to understand. Right? Indirectly attached. Right? And then 11 and 12, they are called as the floating ribs. They are called as the floating ribs. So floating ribs means what? Rib number 11 and rib number 12, they will not be attached. They will not be attached. See over here, right? These are the ribs. Let me have, here it is, right? Here it is. See last one, this and this. Rib number 11 and rib number 12, they are not attached, right? They are just attached to the back side, right? They are attached to the back side, that is with the vertebra, but they are not attached with the front. Okay. All right. So here is, so that is how the ribs, they are designed. Here it is, acromioclavicular joint, right? This one is that white kawa, right? Coracoid process, right? This one is glenoid cavity, that's right. And this one is head of the humerus, head H, right? Head of the humerus. Posteriorly, it is not making any joint, right? Posteriorly, it is not making joint, but it is, yeah, there. But it is connected with rich muscles, so many muscles. The entire back is say scapula is like a flat bone. Why the bones are flat? Because it provides surface to the muscles. So that's what exactly it will do. It will provide rich surface to the muscles, and we are about to see that, right? Okay. So here it is. Now our focus is on scapula, right? So let me zoom it a bit. Yes. And the thing is, we understood that this portion is acromion process, right? So I'll just write A, right? This one, a very shy structure now which is going on other side, it is clavicular, right? That white kawa. Can you see that this entire scapula, right? This is the scapula. This entire thing is scapula. That scapula, right in the middle, there is a big ridge, right? Big one, this one. I'm talking about this one, right? Which is dividing the entire scapula into upper half and lower, upper part and lower part, right? So for this, this is called as the spine of scapula. Spine of scapula, or the spinous process, right? But it is the spine of scapula. So any of the area which is above, it is called as the supra spinous, and below is the infraspinous. Above the spine, below the spine. So we say that there is a portion. So we call that supraspinatus fossa and infraspinatus fossa. Fossa means place, khadda, right? In which all the muscles they will be landing, muscles will be attached. Muscles will be attached in supraspinatus. And name of the muscles, very easy, supraspinatus and infraspinatus, right? Supraspinatus and infraspinatus. So that area which will be having muscles, such easy names. Same principle, right? The name should follow. So spine of scapula or the spinous process, right? Or the spinous process. The spine of scapula above supraspinatus, below infraspinatus. Function of coracoid? Well, coracoid process is so good, right? Muscle attachments, muscles they attach, and those muscles which attach over there, they are super smart muscles, right? Because when they contract, they give such a beautiful swing to the arm, right? Yeah. So we'll see when we'll be discussing the muscles. But at this point of time, just remember coracoid process is for muscle attachment, right? All those processes, they are for the muscle attachment. Yeah, that's right. Long head of biceps. So here it is again, right? A zoomed view, and we see this. So nothing much to write over here, right? You understand it. Okay. All right. Let's move further. So here it is, just a better view, and you see these things. That is the spinous process, supraspinatus, infraspinatus region, coracoid process, acromion process, right? And the acromioclavicular joint, and the glenoid cavity, and the humerus, right? This is what is called as the inferior angle of scapula. Inferior angle of scapula, right? Now here it is. This is not the image, this is real body, right? That's how the cartilages look like. These are cartilage. And that's how the real bones look like, and that one is the rib, right? So in this, in the entire body, in all the muscles, they have been scraped, just the cartilage and the bones, they were kept, and then the photograph was taken, right? So this is how they look like. This is how the cartilages, they are joined. See, 1, 2, 3, 4, 5, 6, and the 7, right? They are coming directly. And then rest of the cartilages, they are just joining 8, 9, 10, they are joining the 7th, right? 11th, 12th, independent, right? They don't join. Yeah, here it is. This is one of the very nice image, because we have rotated the body and then the photograph is taken to make that concept clear, that scapula, watch it, scapula is actually attached only to clavicle and the humerus, right? But with the body, only clavicle. So thoracic cage, it is independent, right? See, it is like on the back side. This is posterior side. This is the back side, right? This is the back side. That's where the scapula is there, right? That's where the scapula is there. We are watching from the side. So that's why this cavity is the glenoid cavity. That one is the glenoid cavity, this one, right? So this one would be the coracoid process. This one would be the acromion process. And this angle would be the inferior angle of scapula, right? So glenoid cavity, that would be the lateral angle of scapula. Very right? Right? It would be the lateral angle, right? Here it is, right? Here is the glenoid cavity, right? So it would be the lateral angle, lateral angle. Here is one X-ray, right? Here is one X-ray. In this, if you watch, that one is scapula, right? That one is scapula, the only horizontal bone, right? So very easy to identify, and rest are all ribs. This is taken at an angle, right? Why? Because we really want to appreciate that this one is the acromion process, and here we see the break, right? This is the fracture. This is the fracture of clavicle, right? This is the fracture of clavicle. One more image. Watch this. Watch this. Right? See? Yes. This one is clavicle, right? That one is clavicle. Say, this one is humerus. Humerus, right? This one is coracoid process. That one would be the acromion process. Yes, you are right. Once again, it is, yes, clavicular fracture, right? That's right. That's right. See how easy it is, right? So how easy it is to figure out, and precisely this is acromioclavicular fracture, right? So once your concepts in the anatomy are good, very soon you will be able to identify the structures very easily, right? And on top of it, when you'll be learning the principles of radiology, it becomes still easier. Great. Chalo. Let's move further. So here it is where we see all the, this is obviously, right, without telling, you can appreciate that now it is the posterior part, because we can see the scapula, right? The scapula is full. So this is clavicle. This is the posterior part, right? Clavicle is over here, right? This is shown for a different purpose. See, cervical. Says cervical, right? Cervical. That thing is called as the cervical. That is neck. Then thorax. So it is called as thoracic. Thoracic. How many ribs? You say 12 pairs. That means there are 12 vertebrae which are for thorax. For cervical, there are 7, right? Then the lower back, that is the lumbar, right? Very important region. And these lumbar vertebrae, they are literally like gunda, right? If you look at the size, they are so solid, so big, right? Really like gundas. And those cervical vertebrae, they are literally like a very delicate heroine, right? Such beautiful vertebrae they are there, right? They are cervical. Thoracic is in between, normal, right? So lumbar, they are 5. Then comes the sacrum, right? That is what is called as the sacrum. So sacrum are 5. And then last, that is the tailbone. That is what is called as the coccyx. They are 4, right? So if we make a total of this, right? So 12 and this 22, 22 plus 7, right? 29 and 4, 33, right? So these are 33. But as person grows, both of them, they fuse, right? Sacrum, it becomes one piece, right? Coccyx, it becomes one piece. Not atlas and axis. Atlas and axis are C1 and C2. Though if they fuse, so then you won't be able to move your neck, because it is the atlas and axis, right, where it is like a rotatory effect. So we say yes, no, all those things, they are thanks to atlas and the occipital joint, right? Atlanto-occipital joint. So here it is. So because they both fuse, that gives us the total of 19 plus 20, 25 and 26. That's what we were calculating yesterday. 26 vertebra. So it is this way, right? 26 one. Okay. So now humerus is in focus, right? Humerus is in focus. This humerus, which is we are watching the upper end, And till this point, we know about the head of the humerus, right? Head of the humerus. Now these bones, they have got all those shearing effect. Shearing effect means if this is the bone and the muscle is attached, if this muscle, it keeps on pulling, so then that particular piece of the bone, that will become more prominent, right? Because of the tensile strengths and the compressive strengths, so it will keep on pulling, right? So it will be that portion of the bone will grow, it will become more prominent. When it becomes prominent, so we call it tuberosity, right? Tuberosity. So see this portion and this portion, right? They are called as the tuberosity. So rest of the bone is very sharif, but these two areas, right, they are very dominant. So they are like tuberosity. Now, if there are two gundas, so one automatically becomes senior, one becomes junior, right? So over here, this bigger one is called as the greater tuberosity. Greater tuberosity. And this another one, obviously, if he is greater, then this one would be the lesser tuberosity. So this portion, because size is bigger, it is tuberosity. You can look that this is like a junior one. So he is called as the lesser tuberosity. Fine. In between these tuberosity, there is a space, right? You can appreciate that there is a space. I'll use the red color. There is a space, right? This space is very interesting. It is this space through which that biceps, right? The tendon of biceps will be passing, right? Tendon of biceps will be passing. More when we'll be talking about biceps. But remember, there is one tendon for biceps is passing. So that's why very nicely it is said that it is called as the bicipital groove. It is a groove, right? It is a groove. So it is called as the bicipital groove. But then, yes, BB, you are right. Right, that these two tuberosities, they are basically gundas, right? They say, kare, apna naam kyun nahi? Right? So that's why this is also called as, okay, baba, this is intertubercular sulcus. Sulcus means gap, valley, right? There is a space, there is a groove. So it is also called as bicipital groove or intertubercular sulcus, right? The sulcus or the groove which is between two tubercle, right? Greater tuberosity and the lesser tuberosity. Fair enough? Okay. Moving on further. So, you remember yesterday I told you that here is one bone, right? Whether it is the elbow or it is the knee joint, right? Three bones they meet, right? Three bones, three long bones, three major bones. Over here is humerus on one side, right? There is radius and ulna, right? There is radius, there is ulna, and there is humerus, right? Let's form this way. Which one is medial, which one is lateral? How will you remember? Just you have to remember one thing. Where is our big toe or the thumb? Right? So in anatomical position, we'll say the thumb is outside. Thumb is outside, so our bigger bone radius is outside. Right? So this one is lateral. This one is lateral. Right? Because yes, that's right, thumb is outside, so this is lateral. When it will come to knee joint, right, remember knee joint, so over here it would be the femur. On one side there would be as such, this is scientifically not very correct because actually the knee joint is formed between femur and tibia, right? Fibula to just is a side support, but still just we are drawing this for our understanding. So femur, tibia and fibula, right? If they are like this, so then bigger bone is what? Bigger bone is tibia. Our big toe is inside. So this side would be the medial side, right? Because our big toe is like this. This, it is inside. Rest is all, foot goes like this, right? So here it is our elbow joint, right? This one is our elbow joint. In elbow joint, we have not only two bones, but there are some important structures, right? There are important structures. Now, these areas, they are not that big like say, trochanter or tuberosity, right? Greater tuberosity or lower tuberosity, such big, right? No, they are not big. They are slightly small. So that's why they are like protrusion. Sharafat say, right? They are just protruding slightly outside. So we call them epicondyle, right? The new word is coming up is epicondyle. Epicondyle. Epicondyle, right? So this side is epicondyle, this side is also epicondyle. Then to confusion, right? There is confusion. So let's give the side one. This is on which side? Medial side. So this would be medial epicondyle. This one would be lateral epicondyle, right? It would be medial epicondyle and this one would be lateral epicondyle. So that's easy, right? That's right. Now we can watch this surface, right? Such a smooth surface, because that's a joint, right? That's a joint. When you move your hand, right? When you move your hand, watch it, that the humerus is fixed, but rest of the hand is giving so much of mobility, right? It is giving so much of mobility. So this is the elbow joint. That means your radius and ulna, they move so much, so much. So that's why it needs to give that entire movement. And that is thanks to this area, which is called as the trochlea. It is called as the trochlea. Trochlea, right? So that ulna, right? This one would be ulna, right? So that ulna, right? Here is the trochlea. That's how it would move, right? That's how it would move. Fine. The another one, which one is which one is so small, right? Just a sort of head, right? Just sort of cap. So it is called as the capitulum. Capitulum. So capitulum would be talking to radius. That's the lateral aspect, right? And ulna would be communicating with the trochlea. So because the trochlea is bigger, right, wide, so that's why the upper end of the ulna would be like this, so that it can properly move, right? So trochlea, cartilage or bony part. It is a bony part, but it is covered with cartilage because every joint, right? Two bones, they never move bone to bone, right? In between, there is always a cartilage so that it can move freely. When that cartilage is disrupted, broken, or eliminated, so when the bones touch with each other, that is what is when the pain comes, right? All those knee joint pains, right? Thanks to when the cartilage is eroded. And again, cartilage is a live structure, right? There is this entire system is like a very beautiful gear system, right? Very nice gear system. There is a fluid, lubricating fluid. That fluid keeps on getting replaced, right? The synovial fluid. Entire joint is fully packed, and then it works with such a good efficiency. Right? All joints, right? But when you are running at a high speed, so when you want to pick up, right? You want to you want to just go for a nice sprint. So that is when the impact starts increasing. That is when you really land, right? It is your body weight which will be landing on those small joints. So that's the reason why muscles should be so powerful so that they can take that impact, right? We'll see as we'll be discussing the tarsals and metatarsals, right? So this is about elbow joint. So we'll call this thing as head of ulna. है ना? This is head of ulna. Head. This one is head of ulna. So head of ulna articulates with capitulum of humerus, right? What's the big deal, right? That's so simple. But, right, the words look so bhari. And I always say that never take panga with medical students, because you tell someone that, yeah, right, you look like capitulum, right? Then he'll keep on thinking. He'll keep on thinking for rest of his life that मुझे गाली दी तो क्या दी, right? Right? You tell someone कि यार trochlea, you are like trochlea, बस खत्म, right? He'll keep on thinking. No? Trochlea is cartilage. That I talked about. Okay. So when head of radius, no? Head of radius. Yeah. I said maybe. Yeah, it is head of radius, obviously. You're right. Oh, two people have asked. So I must have said head of ulna then. My mistake. Sorry. Right? It is head of radius. True. I'm sorry, Tanmay. I'm sorry. Right? So this is head of radius. Ulna to it has got no head. Right? Ulna has got no head. Ulna to is a very smarty. Right? Is like this. Right? The complete formation. Let's study now ulna. See, here is how ulna looks like. Right? Ulna has got two processes. Right? So ulna, because it is moving on trochlea, so it is like this. It is like this. Right? So the front end is called as the coronoid process. Coronoid process. Right? And this back, this one is called as the olecranon process. Olecranon process. Right? So that is how it is. And in between, this is called as the trochlear notch. The notch for trochlea. Right? Notch for trochlea. Okay. As you have asked for bursa, that what exactly is bursa? Bursa is nothing but fluid filled bag. You can say, Shanak, it is like a fluid filled bag. Right? Fluid is inside. This bag is always intact, and the best part of bursa is avoids friction. Avoids friction. That's the purpose of bursa. Bursa it is when the inflammation occurs, it becomes so painful. Right? So bursa is that it avoids friction. So we have now coronoid process, olecranon process, trochlear notch, and that's what we were talking about the radius and ulna. And in between these bones, in between, right, there is a membrane which is between two bones, and it is called as the interosseous membrane. Interosseous membrane. Right? It is called as the interosseous membrane. Location of bursa, see, ask me, there are so many bursas, right? There are so many bursas. So when we'll be discussing the soft tissues, right, at that point, we'll be talking about that where exactly these bursas are and what exactly they do, because you'll relish it when you'll be understanding with respect to those muscles, right? Okay. Here it is, our all-time great, all-time favorite wrist joint, right? Our wrist joint. Now, the beginning itself is so stylish, right? Literally, the beginning itself is so stylish. Say, here is the radius, right? Here is the radius. Here is the ulna. It is this point where we actually we take the pulse, right? We take the pulse because this is quite a flat surface, and when the radial artery is passing over it, so when we press it on the back side, there is bone, so it gives the support, it gives a area, and then we take the pulse, right? These two processes, this one and this one, right? Very stylish, and that's why they are called as the styloid process, right? Now, obviously, Radius would also say that no worries, I'll also keep the same name, styloid process. So that's why you have to keep on telling that, okay, it is a styloid process of Radius and styloid process of ulna, right? Here comes this area, right? These are all carpals, right? Then these one, they are metacarpals, and these are all phalanges. So let's finish those phalanges first, right? Let's finish those phalanges first. Is there any name for head of radius? Yes, there is a name, head of radius, right? Name of the head of the radius is head of radius. That's the name. Bursa is a fluid filled cavity, a fluid filled, say, bag, and it's located in such a way so that it avoids that friction. See, you should thank that anatomist, because if they keep on giving names on and on and on, at least say some of the names they are thodi daya ki hai ke, right? Chalo, head of the bursa is head of the bursa, right? Otherwise, imagine the name they might have given, some Indian would have given the name Dhurandhar Bhattavadekar. So every time you will be remembering that, okay, Dhurandhar Bhattavadekar is articulating with the capitulum, and you keep on remembering that thing in such a complex way, right? Remember, head of is much easy. हाँ, बच्चे पे दया की है. Now for those carpals, I can sense that you are, so many of you are interested. Keh rahe, yaar, she looks too pretty. Try to catch her. Yeah, that she looks too pretty is over here, right? So let's erase this part so that we make some space for our all-time favorite carpals, right? Carpals. Do remember all these 8 bones very meticulously. Starting with, right, will not leave even a single doubt. Which side is lateral? Thumb is there, right? Thumb is there. So this side is lateral. This side is medial. It is at this point. Now take your wrist in your hand so that you can actually follow the things properly, right? I'll be explaining in slightly more detail so that you remember it very crisply. Think it in 3 ways. 1, name of the bone. 2nd, with which bone it is communicating. When I say communicating, means it is making a joint, right? And the 3rd one, who are the neighbors? If you make these three concepts, entire joint becomes very easy, right? 1, name. 2nd, the joint formation. And 3rd, who are the neighbors? Because not necessary that every time they will be making a joint with the neighbor, right? So do remember that. So that's why these 3 points you should always remember. We'll see more in detail, but let's start with she looks too pretty, right? I know everyone waiting. So we start with on lateral side. Why lateral side? Because when we were discussing pisiform, we said pisiform is here, right, on the medial aspect, and that is sometimes it gives pain, right? That small bone. So yes, we know this pisiform is here, which is on the medial side, right? Which is on the medial side. She looks too pretty. So pisiform, right? There are 2 rows. From the lateral side, this is lateral side, this is medial side. Pisiform is here, so obviously we have to start from the lateral side, right? So looks too pretty. First one, the scaphoid, right? Here is that scaphoid. Scaphoid is what? Scaphoid is like a boat, right? Scaphoid is like a boat. See, the scaphoid is talking with radius, right? Here it is. It is talking with radius, right? Its neighbor, the next one, lunate. Lunate, like a moon, right? Like a moon. Here it is. This one. That is the lunate. So it means it is scaphoid, lunate, and radius. They are making a syndicate, right? See over here, right? Here it is, right? So it is scaphoid, lunate, and radius. They form a joint. Good. The next one. So this is done. This is done. There comes the next one, right? T. T stands for triquetrum. Triquetrum, right? It is this bone. Triquetrum, right? And on top of it, this small one which is sitting over here, and this one is pisiform. Pisiform. So we have got 1, 2, 3, and the 4. Done. Right? First row over. Again, like a typewriter, once again go back to the beginning. Try to catch her. Right? So first one, it is called as the trapezium. So without any hesitation, you will be able to identify trapezium because it is just next to that scaphoid, right? Easy. Trapezium. Yeah, pisiform is a sesamoid bone. That's right. So trapezium. And next is this trapezoid. This one, right? That one is trapezoid. Trapezoid. And then comes a big bone, right? Such a big bone, right? Quite big, right? Quite big one, right? The captain. So let's name him capitate. Capitate. And finally, this bone, right? Finally, it is this bone, this one, right? That bone, it is like hathoda, right? Hammet. That is what is called as hammet. Hammet means hathodi. And it has got hook. So it is called as hook of hammet because that you can hold with the hook and then it is like your handle, right? So that hook is this. That hook is this. Right now, don't worry much about hook of hammet, but these are the 8 bones, right? Trapezium, trapezoid, capitate, and hammet. So here is once again, right? This one is scaphoid. That one is lunate. This one is triquetrum. This one is pisiform. Done. Moving back. Trapezium. Chota sa trapezoid. Big boss capitate. And the hathoda hammet. Done. These are the 8 carpals. Right? Lateral to medial, lateral to medial. Got it? Lateral to medial, lateral to medial. Right? So here is below hammet. Below hammet, there is no one. After hammet, then straight away, these are all metacarpals. Metacarpals. The structure which I marked, which looks like that, that is hook of hammet. Right? It is called as the hook of hammet. So as such, it's not a separate structure. Just remove it, don't confuse. right? It is just the articular surface on which those fingers they move. Okay. So metacarpals, and finally the phalanges. White color, same. That's what I was, right? So, and finally the phalanges. Phalanges, they were 14. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, and 14, right? So 14 phalanges. 5 metacarpals. So this is 1, 2, 3, 4, 5, right? Those 5 metacarpals and 8 carpals. A wrist drop. Well, wrist drop is quite a long topic, right? It is not so that only with breakage of one bone and it leads to wrist drop, but otherwise you can say that when the fall on outstretched hand, right? Fall on outstretched hand, when the hand is like this and the person falls. This is one of the important topic, and the commonest is this scaphoid. Scaphoid breaks, right? Then even this then say it is this clavicle breaks, right? Yeah, mid shaft fracture, right? So all those fall on outstretched hand, it leads. Now see, here it is. See, all these carpals, they are not like मतलब 8 बोन फेंक दिए हैं, right? These are intercarpal ligaments. How strongly all of them they are attached, right? See, such a complex. This makes your wrist so powerful, right? Otherwise, these delicate bones they move, but it is not so that they are just kept as it is. So all these intercarpal ligaments they have got the name, right? And a specific function. Plus there'll be multiple layers of muscles, and as discussed yesterday, there'll be few muscles which will be intrinsic, few muscles which will be say extrinsic, right? Intrinsic muscles they will start within the palm and they will end up in palm. Extrinsic muscles they'll be coming all the way from the top and then they'll be entering into the palm, right? Okay, so this is just for your reference, right? You can just practice it. Which one? This one? No, this is anterior view. How can this be posterior view? See, scapula is on the back side. Ribs are in front. Got it, Asmi? This has to be anterior view. Most important, you can see the sternum. Above? Which one? This one? This one? This is anterior view, like this. All those bones which you see over here. Of hand. This is anterior view. Now, that's the vertebra, and this one is the rib. Only one purpose, vertebra. Only one purpose. That rib is attached with vertebra at 2 points. Rib is attached with vertebra at 2 points. For vertebra, this one is the body of the vertebra. This one is body. This one is called as the transverse process, right? It is called as the transverse process. And on the back side, we have got the spinous process. So this is the spinous process. Spinous process, this one. So obviously this is anterior, right? Because ribs, they come like this, right? So that is anterior, and this vertebra is back. So that one is posterior. Remember, rib is attached at 2 points. One, when it is attached with the body. So this is the first joint. This one is the first joint, this one. And second joint it makes with the transverse process. So that's the second point. That's the second point. So because there are 2 points, so that leads to movement of the ribs. This is the reason that rib becomes so flexible, right? The movement of the ribs, they become so flexible, and that's where like bucket handle movement or all respiratory movements, they come into picture. Name of these two joints, this one and this one, right, should be extremely easy. For the zoom, yeah, I can zoom it. Here it is, right? Let me remove this color also so you can appreciate. Fine. I'll just put this. There is one joint here and there is one joint here. Okay. Joints with the body, with the vertebra. So it is called as the costo-vertebral joint, right? And this one, which is with the transverse process. So very easy, ribs, so costo, and the transverse process. So let's keep transverse, costo-transverse joint, right? Bacche pe daya again. Right? Otherwise, again, they could have given some khatarnak name. So this is again the bacche pe daya, costo-vertebral joint and the costo-transverse joint. That's real bone. That's how they look like, right? Watch, this is the rib, right? How they really look like. Say this is at an angle, right? So remember, this is the spinous process. That's the spinous process. Okay? So rib, it is forming a joint with this transverse process. So these are the transverse process, right? That's the transverse process. That's the transverse process. This, what you are watching, this one, it is the opposite side's rib which is coming into picture, right? This is the opposite side's rib, right? So because it is taking a turn, that's why we are watching it. And this one is also a transverse process. So that one is a transverse process. This one is a transverse process. This one is transverse process. These are the spine. These are the spines. And over here, in this above one, transverse process has been removed so that we can see things clearly. This transverse process, and here is the joint. So the rib is actually going like this. So here it is making a joint with the vertebra. So that is costo-vertebral joint, right? And here it is making a joint with the transverse process, and it is called as the costo-transverse joint. Got it? Much better, right? Here it is seen much better. So here it is costo-vertebral joint, and here it is costo-transverse joint, right? See how it goes. Interestingly, here is the intervertebral disc. It is intervertebral disc. And now you can appreciate that this disc, when it protrudes back, right, we'll see the vertebral foramen. So at that point, it becomes better. But that's the intervertebral disc. Which image, Nandini? Which image are you talking about? This one? This one, this is the body of the vertebra, right? This one is body of the vertebra. In between two vertebra, this is intervertebral disc, right? And this one is the rib. This one is the rib, costo-vertebral joint, and the costo-transverse joint. Previous one, this one is this and this, they both are same. Just trying to explain costo-vertebral joint and the costo-transverse joint, because this is taken from an angle, right? From an angle, so that you can watch the spine. These are the spinous process, and these were the transverse process. Even previous, this one, this is as if you are watching from the top, right? So it is one point, this is over here. Intervertebral disc, they are made up of cartilage. They are made up of cartilage. So costo-vertebral joint and the costo-transverse joint. Same concept, right? Various figures, various photographs are there to explain the things properly. Here is super zoomed thing, right? Because wanted to explain this vital concept that every vertebra will be making an articulation with the vertebra below and the vertebra above, right? So here it is. Can you see a nice smooth structure which is on the top? It is called as the facet. So it is superior articular facet. Facet means face. So this is which is above, and obviously this will be below, right? And I'm changing the color, and this below vertebra's superior articular facet is here, right? So listen very carefully. The vertebra which is above, it will be forming a joint with the vertebra which is below, and above vertebra this will be having inferior articular facet with the superior articular facet of the vertebra below, right? This is below. So inferior superior, that's how they'll keep on making. So this is one, and see here it forms this foramen, right? Foramen means hole, right? This particular foramen is between two vertebrae. Got it? This is between two vertebrae. So that's why, what name should we give? Intervertebral foramen, right? Intervertebral foramen. Intervertebral foramen. So it is via this foramen the most important thing, and that is the spinal roots of spinal nerve pass. So if someone is having back pain, right? So while running, if someone develops lower back pain, so it is because of the compression of these nerves, right? The roots, when they are compressed, right? So then sciatic is coming out from these roots, but when the roots are compressed, its effect will be seen below, right? So over here, as we let's see if this, yeah, here it is, right? Here it is. So all the via all those intervertebral foramens, right? Nerves will be coming out. So that's how the entire jungle is created, right? Not the nutrient nerves, right? Nerves are not nutrient. They are for the nerve supply. They are the electrical system. You can say nervous system is like an electrical system. It is a connection between brain and muscle. Brain fires that, okay, contract, and nerves, they carry the message कि brain ने बोला है contract, and the muscle contracts, right? That communication is the nerves, and these nerves, they keep on working day and night. So that's why every muscle will be having some tone. So that's why when you hold someone's hand, so then you will be able to get that tone, that power, right? If the muscles are extremely flabby, right, so that means that supply itself is very weak, right? As you exercise, it becomes more and more powerful. Nerves are like Narad Muni. How come Narad Muni? Nerves, the best is electrical system. Yeah, Narad Muni though was very complex. Nerves are very simple, very decent. Flabby means soft. Flabby means soft. So these intervertebral foramen, they carry one important, that is the spinal roots, spinal nerve roots, right? Though there are some other things also in the form of, say, spinal artery, of segmental artery, and the communicating veins, etc. But those things later. Just remember one important, that is the spinal root. Flabby means soft, right? Flabby means soft. Yeah. So here it is, just the posterior view, right? And say a better, yeah, this is where we can see those ribs bit better, right? So here it is, 1 2 3 4 5 6 and 7. See the 8 9 and 10, they all are merging into 7, right? And this is 10, this is 10, I'm sorry, this is 11, this is 11, and this is 12, right? They are the floating ribs. Right. So just few more images for you to see, right? Because these are all real photographs of real body, right? So here it is, he's again giving a smile, right? Because it is like now he is coming to you in the form of as if he's a gentleman, right? So that's the rib 1, that's the rib 2. Here is the beauty bone clavicle. This one is manubrium. This is body of sternum. This is xiphoid process. These are cervical vertebrae, and that's the cranium. These are the facial bones, and this one is mandible. Facet image. Facet image is this one, right? Yeah, he is having tie. But now, say from front, now he is taking it's giving you as a side view. And that's where that Chupa Rustam, that is our hyoid bone. Right? Here is the hyoid bone. That's a hyoid bone. What happened? Ah, okay. So that's the hyoid bone. Right? And from the backside. Right? Backside. So here is that entire system. So here is our skull, and let's dive into detail of skull. Now see this, my guess is we have not finished even 50%, right? We have not even finished 50%. So chances are that if needed, we can go into the second session. Instead of going fast and not explaining some of the things, I think we'll go it in such a way that you understand everything. Is like a floating bone. That's right. Iod is like, because it is connected with all those ligaments. So here is they are anterior posterior everywhere, right? You'll find them everywhere. Some of the ligaments, so they are in such a way that you have to separate two bones to see that. Moving on to this part, and where we will learn about sutures. Sutures, right? Sutures are, skull of the baby is small, brain starts developing, brain starts expanding. So these are the sutures, right, which are not yet fused. So they will literally slide like this so that skull can expand, right? There is name of these sutures. They are actually pretty easy. If you watch from the top, this is the head. We are watching from the top, right? This is front or the anterior. This one is posterior. I'll show you the real sutures also, but this is just for explanation. Yeah, see, basically skulls are, that's Deepak, this is what I always used to wonder. Okay, yaar, internally to we all are very happy. Yeah, unnecessary externally we make this udas face, right? Because otherwise, once all the bones, all the tissues, everything is removed, skull is always smiling. You can't find a it is impossible. You will never be able to find a crying skull. Right? Skull is always happy, always smiling. So anteriorly, muscles are sad. Muscles, no, we can't say muscles are sad, because muscles they work as per the brain tells. So basically it is that sada hua dimag, right? So why to do that, right? Keep the brain happy, right? Your muscles will be happy, so everything would be good. So here it is anteriorly, first one it is coming up, and that is coronal, correct? This is a coronal suture. Right. First, just understand the name, and then we'll see it on the real skull. So coronal suture. Then something which is in midline. So very rightly said, right? We'll call it sagittal suture. So this is sagittal suture, right? And then there is one another suture which goes like this, and it would be called as the lambdoid suture. Lambdoid, lambdoid suture, right? Now this is top view. This is top view. So when it is top view, now you see it from the side. So here is this suture, right? I'll highlight it. This suture which is coming from the top, right? So it will be going all the way from here to here, right? Here to here. So previously we were watching it from the top. Now you are watching it from the side. So this one would be our coronal suture, correct? This one would be coronal suture. Sagittal, we won't be able to see over here because sagittal would be exactly on the top, right? It would be exactly on the top. The suture which is over here, this one, right? It is this one. It is this portion which we are watching, this one or this one, right? So that one would be lambdoid suture. Good one, right? That one would be the lambdoid suture. Now, these sutures, this area and this area, they are not fused. They are called as the fontanelli in case of newborns, right? They are called as fontanelli. Fontanelli means these are like an opening. It is covered with very thin layer of cartilage, right? Very thin layer of cartilage. So this is, they are called as the anterior fontanelli. This one would be anterior fontanelli and this one would be the posterior fontanelli, right? So we have got anterior fontanelli and the posterior fontanelli. Anterior fontanelli's name, it is also called as bregma, right? It is also called as bregma, right? And this posterior fontanelli is also called as the lambda. Which fontanelli closes first? Well, remember, that could be the question. It is the posterior fontanelli closes first. Right? It is the posterior fontanelli which closes first. So that's like an arrangement. Now still there are so many other sutures, right? Still there are so many other sutures over here, right? So that particular suture, right now we are deliberately not touching them, right? It's not so that they are very difficult, very easy. But for that we need to understand first the names of the bones. So once we know name of the bones, the name which is between two, the suture which is between two bones, and it becomes easy that what's its name, right? Yes, posterior is hard. I would like to emphasize one important point. Over here, for that to appreciate, we need to remove and we need to zoom. Because it is an important area, that's why I'm zooming it as much as possible. Right. Can you see there is one suture over here. There is one suture over here. There is another one which is like this H-shaped area. Right. Now I'll remove this drawing and so that you can see it. Right. This area is medically very important. Whenever there is any of the fight, this area is called as the pterion, right? Not paterion, right? P is silent. It is pterion. This is a very, very delicate area. So normally when during the fight, if someone hits a lathi or if there is a punch over here or if any hard thing strikes over here, if this breaks, just underneath, just on the back side, inside the skull, right? When we'll be doing the dissection, I'll show you. But inside the skull, there is one artery which is going on. It is branch of middle meningeal artery, right? It's okay not to, don't remember the name right now, but it is one important artery. Now, because that artery is embedded into the bone, so that artery, it breaks. When it breaks, because it is embedded into the bone, it won't get a chance to shrink. So it keeps on bleeding. It keeps on bleeding. And this is something which can lead to death, right? Especially in football or in any of the game, when things strike over here, right? You must have seen in matches, if the ball strikes over there, so immediately that medical person would come, that are you okay, are there any neurological symptoms? Because yes, this thing is a dangerous thing, right? It is called as the pterion. Pterion is the weakest part into our entire skull, where these four sutures meet, right? H shaped. So that is what is called as the pterion and not the paterion, right? This is for the internal bleeding. Exactly, this is the internal bleeding. So here is once again the smiling skull, right? So we have this one, right? All the way over here to here to here, right? It goes like this and this and this. This is frontal bone. This bone is called as hemorrhage, internal hemorrhage. This bone is called as the frontal bone. Just for the practice, right? You can later on you can all name all those bones, all those sutures. So here it is, right? This one is the frontal bone, right? The next one, say regarding the face, this one is the maxillary or the maxilla. This is the maxilla. So we can say that we have to write right or left with perspective to that person. So this gentleman would say that this is his left side, so this is the left maxilla, right? The way, so that is left maxilla. Now this one, this is which really forms your cheeks, right? When you smile, right? So it is this, zygomatic bone, right? So usually when we give punch, right, we give punch over here. So it is bichara, this zygomatic is always at stake. So this one, right, you know this, right? This is right maxilla, so I'm not writing it. This is right zygomatic, right? Because this side is right, this side is left. So this is right zygomatic. This one, that is from the lateral aspect. So this one would be maxilla, right? That one is maxilla. This one is, that's right, zygomatic, is watching from the lateral aspect, zygomatic, right? This is very beautiful bone, most complex, sphenoid. This bone is so mysterious, seriously. Such a mysterious bone that when you cut the skull, right, that is when you cut the skull cap, you open it and then you watch inside, right, you'll find the entire empire of this sphenoid bone, right, with like wings fela ke baitha hai, right, like a butterfly or the bird. So it is, that's where, so it, you'll find it inside, you'll find it outside, right? Very, very fine bone, very, very royal bone, right? In head and neck, it would be a pleasure to learn this bone. Here it is, a very sharif bone, right? Very Siddha Sada bone, temporal, right? Temporal. But very important. This bone, right, over here, This is this kan, external acoustic meatus. Meatus means hole, acoustic means sound, external means it is a hole which is for listening to sound, right? So if there is external acoustic meatus, there has to be internal acoustic meatus, otherwise so we would have said only acoustic meatus. Yes, there is that internal acoustic meatus, it opens inside, right? And imagine how amazing things are, that this is fully a bone, right? So from this point all the way to internal acoustic meatus, right, there is a bony canal, and in between that bony canal all those three cute ossicles, they are sitting, right? Malleus, incus, stapes. So actually when you do the dissection, that's where you find कि हाँ, so comfortably they are sitting, right? That's where they are formed. Moving on to this simple bone, most simple sadhu like bone, parietal, right? कोई मगजमारी नहीं, एकदम simple, एकदम honest, right? That's the parietal bone. This is boss, right? Occipital bone. Why boss? When you look at this bone, right, it's really so powerful, right? So here it is. See this, right? The top view. Here it is, the coronal. This one is sagittal, and this one is lambdoid. So here it is, coronal suture. This one is sagittal, and this one is lambdoid. Now this reminds me of one more suture which is present over here, right? Later on it fuses. So it is also called as the metopic suture. Metopic suture. So that's how these sutures, they all are arranged. This one, this one, this one, and this one. And when you cut, right, you just make a window and you find that, see how graceful the internal of the skull is, right? And all these parts, they are for the blood vessels. There would be royal arrangements of all those blood vessels, right? Just here it is, right? And every vessel has got the name, and this is just vein. Then when we add arteries, it becomes more lavish, right? Now, as we said that occipital is like Gunda, now let's see his Gundagiri. See how much area he has covered. This one is occipital. We are watching the posterior part. We are watching the posterior part of the skull. We are watching it from the back, right? So see here, this, right? This, as if he is doing like this, right? So that is, all these are occipital protuberance, right? They are called as protuberance. Just protuberance means prominence, right? Nothing more. But as we rotate the skull, we see that how mesmerizing this bone is. Here it is. This is, we are watching, if this is the skull, we are watching from below, right? We are watching from below. See the teeth, right? See the teeth. This is like we have removed the jaw. We are just watching from below, right? And that is called as the foramen. Foramen means hole, magnum, huge. And it is via this foramen magnum the spinal cord passes. It is the brain, and then the brain, it goes in down. And over here you'll find that medulla oblongata, right? Midbrain, pons, and the medulla oblongata. These are the parts, and then it continues in the form of the spinal cord, right? It continues. So this is foramen magnum is handling this area. That is what passes through it, right? See, these are some real images for you to appreciate, right? Here it is. See how the lambdoid suture, right? How the lambdoid suture looks like. This one, lambdoid suture, right? Right. Now, eventually, there is one another interesting thing which I would like over here. Just behind your ear, just touch the area which is just behind your ear, right? You find something which is solid, right? This one, it is this. You are palpating, right? You are feeling a process called mastoid process. Mastoid process, right? And this one, a very thin, delicate, right? A small process, very stylish. So, styloid process, right? Mastoid process, right? Majboot. Styloid process, very delicate. Now, when you see it in real, that's how they'll really look like. Here it is. Here it is. That's the mastoid process. Mastoid process. And this one is the styloid process. Right. Here is the real dissection. Absolutely a real dissection. Right from the sagittal plane, the entire head has been cut, and you see so many structures, right? Some of the soft structures. That's a real dissection. So appreciate, this is like mouth, right? This one is mouth. So this is this one, this top one. This is hard palate, right? The palate above, right? So which is different, this is like a partition between the nose and the mouth. So that is the hard palate. And this posterior one, right? This is a soft palate. Soft palate. So when the soft palate is touched, it gives the gagging reflex. Means you feel like throwing out, right? You feel like vomiting. So that is the soft palate. This one is the tongue, right? See, so muscular. Yeah, there are so many muscles in the tongue, right? That's why it moves so much, right? And these are called as the nasal concha. Nasal concha, right? Superior, intermediate, inferior, and then there are so many structures. And this would be the area where the brain would be, right? This is the area where the brain would be. And then say this is where the spinal cord would pass, right? So these are the body of the vertebra, right? These are the spinous process. These will be the spinous process. So when you draw the vertebra from the top, right, it goes like this. That's the body of the vertebra, and the spinous process would go like this, and here will be the transverse process. So it is this area through which the spinal cord is passing. So when you take a section like this, right, this is the body, right, this is the spinous process. That's what you are watching over here, body and the spinous process, right? Still the entire lower limb is left out. So what we do is we stop at this point, right? Tomorrow we shall resume and we'll finish rest of the structures, right? Because we'll need at least 45 minutes right now, right? Well, laptop or iPad, laptop is where the storage would be good. iPad has got restricted storage. Even a good quality iPad will be having what, 1 TB? 1 TB is more than means maximum storage available, right? So preferably laptop is fine. iPad is for mobility. Once you are through with the laptop and you have used it thoroughly, then you can think of iPad. All right, so we stop at this point, right? Do revise it. I'll put these images, right? I'll put this entire file, and tomorrow we meet once again for rest of the portion. Okay, thank you so much, and we shall resume from this point. So thank you and see you tomorrow. Bye bye.